Good evening, Donald from D&D Defense, back with another video. Today's video is going to focus more on the medical components of self-defense. When people tend to hear self-defense, they think more of, combat, whether it be with their fist fights or stabbings or shootings, so on and so forth. And while that's an element of the trainings that I do, I think it's important to note that self-defense has multiple elements to it. So that's just one element. Another element is having the right supplies. And that also, having the right supplies also includes your firearm, knives, and sheaths to keep your knives, and then obviously your ability to grapple and use your hands, so on and so forth. But that being said, medical supplies are equally, if not more important, because in most, if not every self-defense scenario, there's going to be wounds. There's going to be some sort of wound care, whether it's just a fist fight and you have some cuts on your face or on your knuckles and stuff like that, to a stabbing or a shooting where there's more severe wounds. And so having a medical kit that can basically address all of that is super important, because the whole point of self-defense is survival, essentially, and not just survival of yourself, but also protecting the innocent. And so if there's an innocent that has already been harmed, well, it's the preservation of life. And so if I use my firearm, that's to preserve life. If I use a knife or my fist, that's to preserve life. Well, if I have to use my medical kit, once again, that's to preserve life. And so your self-defense should encompass all elements of self-defense, and that also includes having the right medical supplies and having the basic understanding of how to use them, which is why I have this diagram here, which I'll get into in a minute. But first I'm going to go into some of the supplies, starting with some of the more basic supplies and then working up into supplies that address more severe wounds and bleeding. So starting off with kind of your most basic items, Band-Aids, antiseptic wipes. There's little bobby pins in here. That's mainly if you have like a wrap or something that needs to wrap around and there's no like glue substance to it to keep it to stick. Then sticking a pin into it to maintain its integrity is important, especially if you're creating a sling with kind of like a makeshift wrap. In order to keep those things in place, you may need a bobby pin. I'm not saying that you absolutely need it, but it's always good to have those just in case. Once again, you keep a gun not because you plan on using it, but just in case you need it. You keep a knife, so on and so forth. You get it. You train martial arts, so just in case something happens. So once again, your supplies should be no different. So just if you're thinking you may not need it, well, just in case you need it. The next item is, gloves. Obviously, anytime, it's super important. Anytime you're ever treating anybody, particularly when there's blood involved, mucus, saliva, any type of, moisture or substance that's, you're going to have to deal with. It's always good for sanitary purposes to be wearing gloves. And you'd be surprised how many people under pressure will forget the most basic things, such as gloves. So when you're treating someone, it's always important to make sure that you put on your gloves. The next thing is your basic sterilized gauze for any type of wound care. Now, this will only treat, basic, cuts, maybe a slighter, deeper wound, depending on where it's at. But remember, you're using this not to necessarily stop the bleeding. I mean, it is part of that, but the main component of that is maintaining the pressure, and then utilizing something like this, or this type of not gauze, ace bandage to wrap around it in order to seal the gauze. But once again, for a serious wound, whether it be a knife wound or a stabbing, or, you know, in my case, I actually was chasing an intruder out of my house, and in the process of that, I got cut, and pretty much cut to the white meat. And so something like that, this was not going to help. I ended up having to go to the hospital, and I got like, I want to say like roughly around 20 staples. Even stitches didn't help because the skin was just pulling it apart. But that being said, this is limited to the type of wounds that it's going to address, but always good to have, you know, just in case the wound isn't that bad. Or there's multiple wounds. You know, another thing to keep in mind, there may be a serious wound, but there may be other wounds that need to be treated. Or other people, in the case of a mass casualty event where there's multiple injured, you know, there may be some with just minor cuts and bruises, and then you got others with severe trauma. And so having a variety of different items to treat everybody is super important. I understand you're not going to have an ambulance on hand, but at least you'll have some basic supplies to help as many people as you can. Another thing that you should have, tape. Once again, that's always important, for no other reason than to tape things and keep them kind of compressed. Also, you know, if you have to mark anything, mainly for medical professionals, and I'm kind of getting the cart ahead of the horse here, but as you can see here on this tourniquet, there's a white tag. You'll write down the time that you placed the tourniquet, and that's mainly just because when the medical professionals arrive, they need to kind of have an idea when that was placed, so they have a better idea of how to treat that individual. But you know, you can also use tape if for whatever reason this is too hard to access, or you know, it's easier to write on, whatever the case may be. You know, you'll find a purpose for it, certainly. So another element of your survival kit or medical kit that you should always keep on you, mind you. I keep one within my home. I keep several within my home. Several first aid kits, plus my medical kit on my tack vest, and then I keep like one or two smaller medical kits in my vehicle. But those medical kits hold more items, and items that would treat more severe wounds, just mainly because the likeliness of you encountering a more severe wound while out in the world as opposed to in your home are those chances are greater, which is why the type of items I carry in my kits outside are a little different from what I have inside the home. That doesn't mean that a severe injury can't occur in your home, but it's less likely, particularly when you're speaking of, you know, self-defense incidences. Next is triangular bandage. Once again, I don't have too much experience with these. I believe this is used to be utilized as like a sling, so to stabilize a particular limb if there's any injury to the joint. I know when I dislocated my shoulder, we used a makeshift sling. I believe this is something to that effect that would allow for you to be able to do that. Next thing is shears, or, you know, colloquial term, or, you know, your regular term would be, you know, scissors. But more in the medical field, they call them shears. And the purpose for that are for no other reason than, you know, as you can see, I'm wearing long sleeves. Well, if I have a wound that's underneath this sleeve and it's bleeding bad, well, they need to be able to get to that. And the only way they'll be able to do that is to cut off or cut through the articles of clothing. Just remembering that if you do have to do that, just be very careful that you don't create an additional wound when you're doing the cutting. Most of these have kind of a safety mechanism on it. Like this one has like a plastic kind of coating around it. This one doesn't, but it's not really sharp, so you shouldn't really run the risk of that. But stranger things have happened. Next is what's called a trauma wound dressing. This is basically a one and all, where you press on it, pull the bandage, and you wrap it. So it's basically a 2-in-1 as opposed to gauze, like placing the gauze and then wrapping an ACE bandage around it. This is basically serves as both. But once again, if you only have 1 or 2 of these and there's multiple victims, well, then you need to start using ACE bandages and gauze and whatever you have available to help as many people as you can, depending on how many people there are. And it doesn't always have to be helping other people. The one life you may save may be your own. And so, you know, in a self-defense scenario, you may have put down the attacker, but you caught a bullet yourself, where you got stabbed or sliced, and so you need to be able to treat yourself as well. So that's just as important, that if not more important, is helping others, because what good are you to others if you are leaking blood yourself and you can't even help yourself? So always keep that in mind. Self-defense is about going home safe, while simultaneously preserving your life or preserving life, and that includes your own. And lastly, I would say your tourniquet. And so here I have 2 different tourniquets. I have one that I keep at home, which is called a SWAT tourniquet. I'm gonna be brutally honest, I've never had to use one of these. I've never had any practice with it. Mainly because I haven't heard really good reviews about them. So I don't want to say that they're bad because I don't have experience with them. But based on reviews that I've heard from more experienced people, they don't necessarily like them. But in a pinch, you know, if you don't have a cat tourniquet, then by all means, you know, use this. I mean, it's pretty straightforward. They have the directions on the pouch. So, I mean, you know, it's not overly complicated to read 3 instructional directions that's on the pouch on how to use it. But certainly an option, and a very viable option to keep in your medical kit, especially if you don't have what's known as a cat tourniquet, which is what this diagram is referencing. So what a cat tourniquet looks like is, and I'm sorry, I'm just gonna undo this quickly. And so essentially this is what a cat tourniquet looks like. And as you can see from the diagram, this will wrap through the arm, place the tourniquet between the injury and the heart, not on a joint, because the joint, once you start twisting it and, you know, putting pressure on it, you don't want it on a joint. You'll just hurt the joint. And so and remember to put it at least three inches, up to 3 inches above where the wound is. So if the wound is here where the hand is at, then you should be pressing it just above that. And the purpose for that is to cut off any blood supply, because if it's leaking here and you press here, you'll be, you know, cutting it off. And, you know, as a side note, I know Hollywood has done this a lot, you know, people using belts. I can tell you right now, just based on the limited minimal training that I do have in this area, it won't work. It won't work. So, you know, once again, as a disclaimer, I'm not a medical professional. This is just for information purposes only. But that being said, a belt is not going to act as a tourniquet. It just won't. That being said, once you've got it placed on properly at the 3-inch or so threshold, that's when you begin turning this little stick around like that until it tightens. Once it's tightened, or you've observed that the blood has stopped, you will then move on to 3, taking this windlass band here and buckling it or locking it into place so that it remains in place. Now, don't stop twisting until you've completely sealed the bleeding. So until you completely cut off any bleeding. And then, as I alluded to earlier, once you've done all of that, there should be a white tag on the inside that will allow you to write on it. And in fact, this tourniquet that I have here doesn't appear to have one, or at least I don't see one. So once again, you know, depending on the tourniquet you got or where you got it, it may not have this white tag where you can write down the time in which you placed the tourniquet. Which, you know, going back to the tape that I showed earlier, a perfect example of where you would use that. You know, place the tape on like their shirt or near the tourniquet, or on the tourniquet for that matter, like right here on this little space right here, the date, or not the date, the time that you place the tourniquet. So that way when medical professionals arrive, they'll know the time that you placed it on, and will have a better idea of how to treat the patient upon arrival. So with that said, I'll end this video here. I hope you liked the video and found it informative. If you did like it, please hit the like button. And if you want to see more content like this, or more self-defense stuff with firearms, jiu-jitsu related stuff, martial arts components, whatever it may be, please subscribe to my YouTube page. I also have an Instagram handle that's D&D underscore self-defense underscore defense underscore. Also, you can find my Facebook page, which is just D&D Defense. You should just be able to look it up there. My website is dnddefense.com. You should be able to view all the services that I provide. There is one service that I do provide that is not currently on my website, which is CPR certification as well. I do provide that as a service as well. That being said, I'm also in the process of looking to rearrange and update the website that I'm currently operating, more so with the services that I'm providing it, to make it a little more conducive for people. But until then, if you have any questions, concerns, my contact information is on that website, or you can contact me through my web or YouTube page by commenting below this video or any other video that you may see of mine. So again, if you like this video, please like the video, hit the subscribe button, and see you on the next video. Thank you, and be safe.